Hello and welcome to this video. In this video I'm planning to show you some simple exercises to help you recover from an ankle sprain. Ankle sprains are the most common injuries we tend to see in minor injuries and emergency departments. Most do not require any further treatment other than simple rehabilitation measures. I'm going to cover the anatomy of the ankle and the areas that are important to the rehabilitation process. I'm then going to discuss and demonstrate some simple exercises that you can do at home to help you get better. These instructions are ones that are often given at the time of your injury, and it is the spiel that I give all my patients when I see them in my clinic. I hope you find this of interest and beneficial.
When you twist your ankle, the most common way to do it is to do it this way, into inversion. This diagram shows the ligaments and structures on the outside of the ankle, which are the ones that are damaged in inversion. The three key ligaments are highlighted in the darker purple colour. The ligaments are at the front the anterior talofibular ligament, and at the back the posterior talofibular ligament, with the calcaneofibular ligament the middle of the three. This is the anterior and posterior talofibular and the calcaneofibular ligament. The other main structure is this tendon here, which is a muscle that helps stabilize and strengthen the ankle and is a key part of the rehabilitation process. Sometimes you turn your ankle inwards or into eversion. This usually requires much greater force, and any injury is greater because the ligament is so strong. Again, the medial ligament of the ankle is highlighted in the darker purple, and again there are muscles and tendons that go behind the ankle that help stabilize the ankle. These structures are those that we work on as part of our strengthening and rehabilitation. Here I am showing the ankle being pulled into inversion, and this shows the stretching that occurs predominantly at the anterior talofibular ligament. The range of movement at the ankle is demonstrated now. Dorsiflexion or flexion, plantarflexion or extension, inversion and eversion. The ankle can also move in circles, which is known as circumduction. The first aspect of the rehabilitation process is to get the ankle to move, increasing the range of movement. Imagining you have a pencil stuck between your big toe and second toe, spelling the alphabet in lowercase letters, going from A to Z 2 or 3 times, 2 to 3 times a day. It is important to see that the movement is coming from the ankle, and as you can see, all the movements up and down, side to side, and round or circumduction are covered by this exercise. Initially you will find that the movement comes predominantly from the hip and the knee, but with work it will start to come from the ankle. Strength is also an important part, and we have discussed the muscles that help to stabilize the ankle. Firstly, find a solid surface such as a wall and try and turn your foot in against the wall, doing this sort of movement using the wall as the resistance. This will look like this. Following the next movement is an eversion movement, turning your foot outwards against the wall as shown here. This is then done using the wall as a resistance whilst trying to push against the wall with your foot. This will help strengthen the muscles on the outside of the ankle to help improve your stability. You can also use resistance bands like this, with holding the knee and leg still using the band to provide resistance against inversion or turning the foot inwards, as in this image, or eversion and turning the foot outwards, as in this sequence of images. These will add a dynamic effect to the static movement tried using the wall as a resistance. The next part of the rehabilitation is balance exercises, starting with simple balance exercises working on one leg. As you can see, just standing on one leg with your eyes closed requires a lot of work to maintain this position. This will get easier with practice. To make it more difficult, you can then take an object in your hand and pass it behind your back and in front of your body repeatedly, so that your center of gravity is changing and your balance still has to be remained. Do this still with your eyes shut. Other things that I suggest to patients to do is to do day-to-day activities such as hairbrushing, brushing your teeth or washing the dishes on one leg, because then your center of gravity changes and you are having to adapt for this. This will help build the strength and the balance in and around your ankle. Once you can do this, we move on to much more dynamic exercises such as a hopping exercise. The first stage is to hop upwards on the spot and land on the same leg. The key is that you land solidly, not having to take a second hop to get your balance back, and you don't give the second hop until you are stable. Once you can do this, you can move on to stage 2, which is exactly the same, except this time, as well as hopping upwards, you hop forwards in a straight line. Again, make sure the balance is stable before you take a second hop. If you overbalance to the side, regain your balance and start again. But try to keep your other foot off the ground so that you are trying to balance with your injured ankle. Once you can do that, we add in a third dimension, so we are now hopping upwards, forwards and to the left and right alternatively. So as can be seen here, our athlete is going to one side then to the other. The forward movement can be seen in the view from the side now.